say one of the biggest mistakes we as humans can commit is to not take coronavirus seriously. We've been asked many times to follow COVID appropriate behavior judiciously, which primarily includes wearing masks, hand sanitization, and adhering to social distancing norms. But what if I were to tell you that this is exactly what the people in the United States have been asked not to do? Yes, you heard me right. I'm Neha Bhan and you're watching TV9 Digital. US Centers for Disease Control and Prevention has said that fully vaccinated people do not require to wear a mask. CDC wrote on Twitter, if you are fully vaccinated against COVID-19, you can resume activities without wearing a mask or staying 6 feet apart, except where required by federal, state, local, tribal or territorial laws, including local business and workplace guidance. While praising the CDC's fresh guidelines, US President Joe Biden said, and I quote, "I think it's a great milestone, a great day. It's been made possible by the extraordinary success we have had in vaccinating so many Americans so quickly." The question is this the right approach? To find that out, I spoke to reputed pulmonologist Dr. Parmesh a little while ago.
Welcome, Dr. Parmesh. First up, as per CDC, one doesn't require to wear a mask or follow social distancing norms, if fully vaccinated. Now, this is applicable for both indoors as well as outdoors in most settings. Do you agree?
I don't agree. We should wear the mask as a matter of fact. This is a wrong statement. I feel we should not adopt that. There is a reason for it. One is, when we get the vaccine, there is a feeling that with 100% protection, no, we don't get 100% protection. As a matter of fact, we can able to get second infections. We can able to spread the disease also to a certain extent. Our own close friends have been seen having 2 doses of vaccine, having contacted again, and one of them have died, as a matter of fact. I think we should not take for granted. We should follow the strict guideline, as a matter of fact, until we are free from the pandemics.
President Biden says fully vaccinated people are at a very low risk of contracting the virus. But one cannot really say this with confidence, as the new variants and mutations of the coronavirus, that have emerged in various parts of the world have infected such people as have been inoculated, and these people have tested positive, isn't it?
As a matter of fact, this is politically motivated. They want everybody to come out and cheer them up and all this thing. This is politically motivated. I don't think we should accept that as a scientist, as a matter of fact. Even CDC, what they say, in the hospital atmosphere, you have to wear the mask, you have the 2 doses. The second thing is, if some company you go there, if they mandate you have to wear the mask coming to my office, you have to wear that one. Third thing, as a matter of public transport, if you're going there, you wear the mask. Or which this order we might have to change in future if you tend to get the infection. These are all the other short linings are there for the CDC also. This we have to keep it in mind.
And
Yes.
What's surprising is that this is coming from a country which still has the highest number of cases in the world. So the question is that what kind of example is the US setting before the world?
I think it is not setting a good example. We have to follow our own guideline with our philosophy, what it is. With this turn, we have to do our own. Think locally, act locally, propagate globally, our results globally. Yes, we should stick to our leaders with the scientific advisors, what they're guiding us, not to follow them.
So you advise that people should definitely wear a mask, adhere to social distancing, no matter what.
Exactly, I recommend that.
Okay. So lastly, if cases are decreasing in any part of the world, as happened in India during the first wave, can that be taken as a COVID-free atmosphere given what we are now witnessing in India with the second wave?
Well, I don't think we should. This is the surprise that has come. Many of us, after the pandemic, generally second wave is coming is a very low potency. This is the belief. And this is the guideline has recommended by the government of India and also WHO. Unfortunately, we face such a horrid the second wave, with the variant mutants, we are more aggressive, more infectious, or more seriousness. Younger is getting affected, and death also happened, as a matter of fact. Naturally, we should not take it for granted. We have to follow the guidelines strictly. Whether third wave is going to come or not, we don't know. We expect that one, prepare ourselves to handle this situation while strictly following the guidelines of the hand washing, face mask, and distancing ourselves. And this social distance is very, very. Having 2 doses, many people think that's what I call Peltzman effect. Peltzman effect is when the safety measures or any country is mandated, you got a 2 vaccine, you feel you got a protection. Those people perception of the risk is very high, as a matter. It decreases, they get more infections. That is Peltzman effect, what we call it.
Right. Dr. Parmesh, but what made CDC say this? At a point in time where people are dying, in fact, they have, as an example, they have India right before them. So why would, the CDC say this? What made CDC say this, that wearing of mask, not adhering to social distancing, if you're fully vaccinated, is absolutely fine? Why?
Well, this is a difficult question to answer, as a matter of fact, because in their guideline, many people disagree. They won't agree, as a matter of fact. Various reasons might be there, whether politically motivated, what are things we don't know about it. I think difficult to answer, but anyway, I recommend to wear the mask, as a matter of fact, and follow all the strict guidelines recommended for the preventing the spreading of the disease without any compromise in the social distancing phase using the mask. But it's difficult to answer why they made it all. We do respect CDC, but themselves, scientists also varies themselves, as a matter of fact. So various things might be there. We don't know. We don't want to get into the political issues.
All right. Understood. Thank you very much, Dr. Parmesh, for joining us with all of those important insights.
I have been telling you to follow and listen to what experts are saying. In this case, I'll strictly advise against not practicing COVID appropriate behavior. Please follow what the doctors say and stay inside your house to be safe. Thank you very much for joining me. If at all you've liked the information that I've shared, do not forget to subscribe to TV9 Digital across all social media platforms. Stay safe, keep those masks on.